We're going to talk about genital herpes today. Genital herpes, a common sexually transmitted disease that causes not only distress, but also an unfair stigma amongst those who suffer it. At least 1 in 5 adults in the United States is infected with the virus that causes genital herpes, but many people have mild or no symptoms and do not realize even that they are infected. Genital herpes is caused by the infection of herpes simplex virus, or HSV, usually type 2. It can also be caused by herpes simplex virus type 1, which is the one that causes oral herpes, or those cold sores in the mouth and lips. The signs of an episode of genital herpes may include multiple blisters in the genital area that are really uncomfortable. These blisters can become painful ulcers. However, many people infected with genital herpes never even experience symptoms. They may also be tender, swollen lymph nodes in the groin, even flu-like symptoms such as joint pain, fever, and a headache. And it may be painful to urinate. Up to 50% of people with a recurrent outbreak may have some symptoms prior to the lesions. They include itching, tingling, or pain in the buttocks, legs, or hips. Illness, stress, sunlight, and fatigue can trigger recurrent herpes outbreaks, and in women, even menstrual periods can trigger an outbreak. A very common question the patients ask me is, when did I become infected? Well, the first time a person has noticeable signs and symptoms of herpes may actually not be the initial episode. It is possible to be infected for the first time, have few or no symptoms at all, and then have a recurrent outbreak with symptoms several years later. For this reason, it is often difficult to determine when the initial infection occurred, especially if a person has had more than one sexual partner. Therefore, a current sexual partner may actually not be the source of the infection. Several tests may be used to diagnose genital herpes. These can usually confirm the infection and identify which virus it is. Is it HSV1 or HSV2? The choice of testing depends on the symptoms and whether you have any blisters or ulcers at the time you see your doctor. PCR, or polymerase chain reaction, which we have heard about with this issue with COVID, and cultures are preferred tests for a patient who has active ulcers. However, blood testing can detect antibodies too, which are these proteins that are produced by the body in response to a foreign substance, and that tells that we are developing some sort of immunity. However, having these positive antibodies only indicates that the person has been in contact with the virus in the past, and it doesn't tell me anything about the current infection. How do we get it? Well, the herpes virus is most often transmitted between partners during oral, anal, or vaginal sex. It is also possible for a person to develop genital herpes after exposure to a cold sore on an infected person's lip during oral sex. In this case, genital herpes is most likely due to the infection with HSV type 1. Transmission from person to person can occur even if there are no visible ulcers. A particular and very important instance is during pregnancy. Women who have their first outbreak of genital herpes near the time of delivery are at risk of transmitting herpes to their newborn. Therefore, careful planning during the pregnancy needs to be done, particularly during the delivery, to reduce the transmission to the newborn. Since herpes in infants is a very serious condition, women should inform their healthcare provider if they have a history of genital herpes. Therefore, preventive therapy with an antiviral medication will be recommended for women during pregnancy. A cesarean section usually is recommended in women who have an outbreak at the time of labor. How do we treat genital herpes? Well, although there is no cure for genital herpes because the virus lives in our bodies permanently, the infection can be managed with an antiviral drug therapy and self-care measures. 3 antiviral medications are used to treat genital herpes: Acyclovir, Acyclovir, and Acyclovir. The most used one is Acyclovir. You have to remember that treatment is most likely to be effective if it is started within 72 hours of the first symptoms. That's why people with a history of herpes or recurrent genital herpes are often advised to keep a supply of antiviral medication at home so that they can initiate the medication at the first signs of a recurrence. In some patients, suppressive therapy might be recommended, particularly if you have had 6 or more recurrences each year or if you have a weakened immune system due to HIV, for example, or the use of immune-suppressing medications or other factors. How do we prevent this from happening? It is important to communicate with a sexual partner before the first sexual encounter. I know that discussing herpes can be uncomfortable and embarrassing, but it ensures that both partners understand the possibility of transmitting the infection through sexual activity. After being diagnosed with genital herpes, it is still possible to have a safe and healthy sex life. However, it is important to take precautions. Using a latex condom with every sexual encounter can reduce the risk of herpes transmission when only one member of a couple has the virus. The more often you use latex condoms, the lower the risk of transmission. Even when a person has no ulcers or blisters, the use of condom is recommended. Sex absolutely should be avoided anytime when genital ulcers are present. Oral sex should be avoided if there are ulcers or blisters around the mouth because a person with the oral form of herpes can give a partner genital herpes by performing oral sex. So these are the 5 things I want you to remember about genital herpes. Herpes infections are very common. You can get infected even if your partner does not have obvious lesions. It is hard to tell when you became infected. Treatment is effective for episodes, but it does not cure it. And finally, practicing safe sex helps preventing it.